And here's a question relating to a family member who is in hospital with COVID-19 infection and is unwell. Is he or she at increased risk for developing blood clots? Should he or she be receiving blood thinners to prevent such blood clots from occurring? Stephanie, you work in a hospital setting. What do you think if you were asked this question?
So the first question with regard to the increased risk of developing blood clots. So patients with COVID-19 who are hospitalized tend to be sicker and need additional therapies such as oxygen and supportive therapy, as we've already mentioned. So in these people, the risk of blood clots is considered higher because certainly of the hospitalization, but as well because it appears from what we know that the COVID-19 infection causes changes in the blood that can lead to blood clot formation. So to answer the second question, so for all of these reasons, it's really advised that patients who are hospitalized with COVID-19 infection receive blood thinners such as the heparin type injections that are given under the skin once or twice a day to prevent blood clots. So the healthcare team will decide, what blood thinner is the most appropriate and what the appropriate dose is based on the characteristics of the patient, as well as what the local hospital protocol may be. Because most hospitals will already have some type of protocol to look at this issue. And certainly there may be occasionally patients who aren't able to be given the blood thinner medications. So there's other devices or measures that can be used, such as special leg stockings or compression devices that help to increase the blood flow.
Thank you, Stephanie. And I just want to stress how prevention of blood clots in hospitalized individuals with COVID-19 is really of paramount importance. And this is the area which is under intense scientific and medical investigation. A lot of the studies are being done in these patients because these patients are at highest risk for thrombosis. So doctors around the world are looking at different ways, different blood thinners, different intensities of blood thinners to help reduce the burden of disease associated with blood clots in patients with COVID-19 who are in the hospital.